this is a kind of a bare bones meeting because it's really meant to foster discussion from our membership. So I'm glad everyone could make it today. So welcome to the Research and Immunology Professional Community Town Hall meeting. Agenda is we'll go over our current leadership group and the incoming members from our recent elections. Review, who we are as a professional community. Go over some highlights that'll be happening in Boston to put on your calendars. And then really spend the bulk of our time today thinking about planning the future in symposium proposals, guideline documents, and webinar ideas as well. And so please interrupt wherever you'd like. So this is your current 2024-2025 community professional community representatives. I'm the chair for this year from UCSF and also representing the Advanced Lung Failure and Transplant IDN. Adriana Zevi is here as well. She's the representative from the Leadership Advisory Forum from Pitt. Mary Amanda Dew is from the Advanced Heart Failure and Transplant IDN. She's also from the same institution. Philia Bilia is here from Toronto and is the representative to MCS. Forum Kamdar is here from the Early Career Training Committee. And then Mark Simon, also now at UCSF, but a member from the pulmonary hypertension and PVD group. And then we have some slated turnovers. So 4 of us are departing, or I guess 4 positions are changing. Forum will now jump from the Early Career Training Committee to the Advanced Heart Failure and Transplant IDN representative. You can see the others that'll be here. Kadir will be for MCS. Roberto will be for PVD, and Julie's taking over for I believe that's the Early Career and Training Committee. That's probably a typo there.
Okay, I was going to say something.
Please. Oh, you were going to say something.
Yeah, I was just going to.
Hey, Stephen.
I was just going to point out that discrepancy, Danny, but thank you.
Well, welcome aboard. We're happy to have all of you and your fresh ideas. Looking forward to the next few years. This is the makeup of our professional communities. So research in immunology accounts for about 4% of the primary professional community membership, though as a secondary affiliation, I think we're one of the top, if not the top secondary affiliation. So maybe a little misleading as far as our overall interest from members as far as professional community. And then these are the demographics at ISHLT in general. Just to review that we're mostly physicians, about 3/4, about 20% are non-physician. We have 10% are trainees, and then 2% are emeritus or retired. And then this has changed a little bit over the last decade, but we're mostly North American and European, but expanding across Asia as our membership as well. And then the bulk of our members are advanced heart failure and transplant IDN members, with lung transplant making up about 1/4 of the society, followed by MCS and PVD. Again, recognizing that we all wear multiple hats and that these are just primary affiliations, whereas a lot of us dabble in other components of the IDNs too, but these are primary affiliations only. So some key dates to remember for Boston, and that we're having our annual professional community receptions. These are going to be from 6 to 7 p.m. Boston or Eastern Standard Time. And this year, we've split when the professional communities meet and trying not to have overlap in the PCs that people would like to attend. So, for example, on Monday, it's kind of the bigger, broader primary professional communities of cardiology, surgery and pulmonology in addition to nursing, allied health and infectious disease. And then research immunology will be on that Tuesday. So you can go to both cardiology or pulmonology if those are your primary affiliations, and then research and immunology on the second day. We'll also be having a breakfast for each of the IDNs at 7 a.m. Monday would be MCS and PVD, and Tuesday is heart and lung. So put those on your calendar. Happy to make these slides available. But these are important networking events and important opportunities to see colleagues. We also have some pre-conference workshops. So there is a CTEF conference, Cardiogenic Shock Academy, Lung Failure and Transplantation Core Academy, and then a DEI and accessibility workshop as well. I would encourage you to participate and kind of promote these as well. This is a really valuable part of what we do as a society. And then this is a list of the webinars that have been held so far. So each professional community and IDN has one webinar in each calendar year. They're not limited to that, but most pull off one. We had ours in November. While we didn't have a tremendous number of live registrants, we've had a lot of downloads on YouTube afterwards. It was a really interesting showcase of some of the exciting science across the IDNs that were research and immunology related. And so if you haven't seen it already, I would encourage you to take a look at that on YouTube. And really, this is a segue into where I hope we can spend most of our time. I'm happy to take some detailed notes and send them out afterwards as well. But really thinking about our future plans. I can pause here, go through this, but I thought first we could think about standards and guidelines that might be relevant to RIPSI. And these are just some that are currently in development that have some RIPSI elements. So in lung transplant, there are consensus documents on acute lung allograft dysfunction, baseline lung allograft dysfunction, acute cellular rejection, antibody-mediated rejection, and telomere biology disease. So they're all either being written or being revised. In pathology group, the processing of heart explants is underway. I believe that's in the writing phase as well. In the heart transplant domain, there's a primary graft dysfunction definitions document that's in the writing phase. And then something that touches upon all groups, there is a xenotransplant for end stage or heart and lung disease that's currently in the writing phase as well. So these are the current standards and guidelines documents that I was able to see that there was some RIPSI involvement. But is there anything being neglected? Is it time to revisit some topics? What does everyone think?
Danny, can I just
Please.
break in for a minute? Olivia and I are here as representatives from the education team, and we just wanted to let you know something new that is going to be in Boston. Each night during the poster sessions, there are going to be featured poster presentations. There's going to be a structure built in the poster hall, and 15 basic science abstracts were selected to be part of this. It will give the presenter an opportunity to do an oral presentation, a formal oral presentation. This is actually something that Danny recommended to us. He was part of the annual meeting task force, and a lot of other societies do this. And we have heard feedback from the research and immunology community that we need to really put a focus on basic science abstracts, because a lot of the presenters are PhDs. This is their work, and they really want an audience to present it to. So we're hoping that this works. We worked with our program committee, the people who were the representatives from the Research and Immunology PC, and they're the ones who helped us select the 15 abstracts that will be highlighted in this way. So the structure will have seating and headphones, so you can hear the presentation. So we encourage all of you to check it out. And Olivia, did I miss anything?
No.
That's fantastic. Well, thoughts, and then please attend so it's successful.
So one of I think the future standards and guidelines, I don't know if it overlaps with the pathology one for the explanted hearts, but something that could span multiple IDNs and professional communities could be related to biobanking. Because I think this is really necessary from a thoracic transplant perspective of, getting, how do we best preserve samples for, molecular analyses and other next generation sequencing to better understand molecular pathways. So, that may be something that spans multiple groups.
I see Steven's window has a hand raised.
Yeah, hi, Danny. Well, first of all, I just want to say I think and to Sue, I think that idea of having the discussed posters is excellent, and I'm really glad to hear that that's going to happen. And then I was just going to mention with regards to standards and guidelines that I think Teresa Martineau is going to advance a document on explanted lung biobanking, processing and biobanking, sort of, I guess, parallel to what's been done for heart. So that I think goes along with what Oram was saying, but maybe one could also envision something complementary that really delves into, as Forum said, the kind of molecular and cellular analyses that aren't necessarily organ specific.
And then if in that explanted lung biobanking, I'm assuming someone from the PVD community will be involved because there's obviously vascular tissue that would be important to preserve.
Indeed, yeah, it's in a very early stage. I don't know. Maybe I'm actually letting a cat out of a bag too early, actually.
No, you mean maybe now's a good time, Sue. I'm not sure, Olivia. Where are we in that master cycle of S&G documents? Remind me, because we just went through this, and then there's going to be a call for new documents in a year, 6 months.
It'll be this year, actually. It's going to start. It's going to start soon. The demonstration of need process is going to begin, I believe, in March. In March of 2025. We do it every other year. So there will be communication that goes out to each professional community and each interdisciplinary network steering committee asking for ideas for those standards and guidelines documents that should be updated, retired, or where there are gaps where new documents should be developed.
So just to talk about the cat out of the bag, I think this is where we generate ideas, and if there's interest in certain topics, then kind of putting together an initial kind of task force or working group is helpful. So if anyone's interested in the explanted lung, which I think sorely needed, I'm happy to coordinate, or you can reach out directly to Teresa. She's always happy to have others involved. And then I want to talk about the biobanking efforts, but before I do, I see Rich has his hand raised too.
Yeah, I guess, Danny, could you maybe briefly just let us know what's like the life cycle of a proposal? So how long, so let's say we come up with a few ideas to pursue, and then what's the process of it being selected, and then how long does it take from inception to probably publication, and what are the steps?
That's a phenomenal question. I'm happy to speak on this, but also defer to anyone from the ICHLT leadership to talk about it. So correct me if I miss it. Sue, I see you unmuted yourself, but I'm happy to also talk about it.
Go ahead. I'm going to send a note over to Megan and see if she can jump on the call because she's the one with the answers.
So there are recently these kind of super cycles, I don't know what we're calling them, of solicitation of S&G documents, more to align each of the work phases across ICHLT. And so the first is just a call for ideas. And so that's what we're essentially doing now, a little bit ahead of time, and it serves to be organized. And so once we have ideas, usually there emerge a few leaders or people that are very interested in pushing this forward. And at that stage, usually just the idea and a very brief synopsis are needed, and that gets sent to the IDNs. So there's usually a primary IDN, though there can be co-sponsoring IDNs, so on certain topics. And then the IDNs, if they get 30 proposals, it's not very feasible to push all of those forward at once. And so they do some selective editing of which to send to the S&G committee. And that's how it's worked in the past. And then the Standards and Guidelines Committee will then review the synopsis and solicit full proposals, which have mostly the leaders, usually it's 2 or to 4 at the most, that will guide the project, and then they will recruit section leads to lead each of the sections of those standards and guidelines documents. And how fast all of that happens, it's probably about 6 months from idea till when the project is started. And then from there onwards, I think that it's encouraged to keep it within a year or so. However, it's a big, depending on the document and whether it's a consensus statement or guidelines, or if there's a Delphi voting, it can take a year or two to get to publication. But generally, I would be surprised if that was under a year. So in around a 1 to 2 year range is what we're talking about. But please correct me if I said anything wrong.
That is all correct.
I guess one follow-up to that, and I see Dr. Zivi on the call, so maybe also get her inputs on this. So as somebody who thinks about complement biology daily, I see like a lot of investigators are using complement staining of tissues, both in human specimens and in animal models. Having said that, I think a lot of the research is based on antibody-mediated rejection and then the pathological criteria for that. And even in the AMR field, there is now some thought that, certainly in lung AMR, there is an entity of C4D negative AMR. So one thought I'm curious about, and this could interface well with the pathology community and also the lung and heart communities, whether we actually, it's sort of more about complement activation in allografts, but then you don't necessarily restrict it to AMR, but also I know there are sites that are doing this for primary graft dysfunction. And then, but bring in pathologists to actually see how is this best objectively determined. But this is a very pie in the sky idea, and I'd like to actually get the pathologist's opinion on this as well.
Currently, Rich, there's the pathology community is revising for lung at least. But I think this is a broader question across organs, right? It's not just lung that we're talking about.
Right.
But
So
there's
it would actually be yeah, I think it would, and that's why I was thinking what would be the best. Like I was initially thinking, could this forum, the research and immunology forum, be the right way to start it? And maybe it is, because really people are using it for research, but I don't think there are any standards how it is used for, they're basing it on AMR data, like clinical AMR data, and then applying it to PGD or whatever. So whether that would actually, how is complement activation determined in allografts? And then you bring in expertise from like heart and lung AMR. But again, it's just what I've realized is the standard doesn't exist. And so is there merit in it existing, given more and more people are doing this work?
If it's something I think that's really interesting, the person to talk to would be Francesca Lenardi from the lung group. She's the pathology IDN representative. I'm not sure who it is in cardiology, but probably looping in those 2 folks would be helpful. And then I know Adriana has her hand raised, probably relevant to this, but we'll also get to Darshan too.
I just wanted 2 things. It's a very interesting topic. The difficulty that you will find is that there is about the standards and all that is because they realize that what you call for a given description like AMR, you have to have the diffuse, but then you have focal, and then you don't find it, but it's not because it's not there, because something with the tissue and so forth. So that's a very difficult area to induce to request a very rigid standard. Research is a whole different story. This is in the clinical diagnosis. With the AMR in lung, it's not only in lung, in kidney and in hearts was also identified that you can have complement independent, what you call it. And so you don't need the complement activation. The idea of the AMR in lung group has put a lot of work. Somebody was saying it takes a year. We are over 2 years. And from we just got the message that it will be again revised and maybe suggested to be published in a different form, not as a guideline. So it all depends, the study, how focused that is, or how, we have this multidisciplinary attempt. And I would say it not failed, but it will require yet another revision and another way of putting out. So it's not so simple. But research standards and clinical standards are very different. So really, we cannot combine that.
Darshan, I know you've had your hand raised for a little bit.
Yeah, thank you. I just wanted to suggest something else that actually came across clinically a few weeks ago. One of the things that we don't do very much in our program is cross-donor specific antibodies when we're undertaking heart transplantation. Some of our colleagues do it all the time. And I looked up to see if there was any updated guidelines or recommendations on best practices when doing so. And there doesn't really seem to be anything very useful in the last few years. And I wonder whether that's something to take on board. We're very lucky. Stephen, who's on the call, and our lung team do it all the time. We can just steal their protocols and they do it successfully. And that was very helpful for us. But I wonder whether there's a bit of space there, just speaking to colleagues outside of Canada, back home in the UK. Again, they have very varying practices. And I don't know whether that's a ripe area for investigation for a guideline or recommendations.
I think that's a great idea. I'm not familiar with any guidelines or recommendations in that realm. This may be something that would be worthwhile collaborating with ASHI over, so that there's, we certainly have a lot of that expertise in our society, but a lot of the immunogeneticists also are ASHI members, and that would be a really interesting collaboration.
And I think Megan Aversa would be also very interested in at least discussing that idea with you, Darshan. She's on vacation this week, so she couldn't make this call, but maybe reaching out to her would be a good idea.
And Greg, if this was going to rise to a consensus document, how does a joint document with another society work? Does the S&G committee decide that has merit and will coordinate, or is it at the leadership level of the document?
It happens within the S&G committee. And they will approve the pursuit of a joint document with another organization, and then we harmonize the process.
Yeah, Adriana. Yeah.
I would suggest, if I would suggest, and I did suggest that in our leadership meeting, to have a combined, type of workshop. I would suggest something that it starts with a combined focus workshop between ASHI and ISHLT on the topic. And then from there, you identify the gaps and the needs and how to follow. It will be, there is a lot of emphasis in harmonizing the laboratory testing, and STAR, which is the group coming out from ASHI and ATC. They are doing all this meeting, like CIOT meeting in February, end of February. There's like at least 4 publications from the STAR group that started in 2017. And every organ and every, clinicians and histocompatibility combined to try to identify where it can be standards, at least guidelines. So I think that in fact has worked between ASHI and ATC. If you want something more specific for IHLT, can be initiated. But I would say it's through these workshops and then coming from there.
I think that's a great suggestion. So I think starting, Darsha, with talking to Megan Aversa, and then seeing what your thoughts are, and then kind of looping in S&G leadership. I'm happy to help coordinate that. If you'd like to kind of go to the workshop level. There's another idea from last. Yeah, go ahead. Oh, there's an idea that was brought up last year to talk about thoracic preclinical models of transplantation. And for that, which is similar to this, we're hoping to plan a pre-conference day next year, not in Boston, but the following year. And then kind of use that to start an S&G process from there. So that's something a little bit more organic that might model this. I saw Eric's hand first.
Yeah, I'm not a basic science researcher, but from a research and immunology standpoint, it does seem like two areas where there's a lot of heterogeneity in how people are doing things. It's kind of limiting the field are one, the thing that you just mentioned, Danny. So like animal models of PGD and injury. I know VIBA had like an NHLBI like workshop thing maybe 10 years ago, but it was more of a narrative review. And so I don't know if this would be like a standards, Greg put like standard statements or consensus, but at least like reporting standards for like a PGD model. Because you see in papers all the time, different people do different things and you don't know exactly what they did. And sort of a related thing, there's a lot more research on like EVLP type research. You know, obviously, Kira's on the call in Toronto and stuff, and just sort of a document, and maybe this already exists, but just on what are the reporting standards, like these are the things we report in the manuscript and a method section to kind of help standardize the field across, because those are a little bit more active and there's a lot of variance in how people report their science.
I like that suggestion. That was part of what Mark Snyder and I were thinking of pursuing. And just as an aside, and this is very kind of nuanced for this group, but we tried to apply at our center some of the ARDS mouse definitions for grading acute lung injury, and it just does not work in ischemia, reperfusion injury, or PGD models in the mouse. So this is something distinct that probably needs to be a consensus document at some point.
Yeah, something akin. I mean, Harish had the ATS thing with ARDS, but I think that's kind of a little bit something like that. Maybe not as far as that, but just at least reporting standards to sort of help people.
But I think the background or a background question related to that is there's a lot of opportunity for guidance, I think, to the field of like, what are our best biomarkers of organ function? What are the best markers of a donor lung function? What, like, if we're doing EVLP or other advanced perfusion techniques, like what do we, like, we all know that sort of looking in the lung for like PaO2, like we all kind of know that that doesn't really reflect the complexity of the lungs, but it's kind of what we got. So there's a lot of technologies available, a lot of opportunities in organ support spaces to try to unify efforts or kind of get people on the same page, whether that's a, you know, mitochondrial readout for a heart or a barrier function readout for the lung or whatever it is. There's lots of options. And I think that's even a space where like the abdominal transplant people don't have sort of AI big data type assessments of their organs. So that might be a neat, I don't know whether it's you can't really have standards until you have breadth of what people are doing, but might be a good workshop or working group idea to get people in the same room thinking about like, how do we as a community paradigm shift what we're doing?
Gary, you're always so good at the big picture questions.
Spend a lot of time thinking about this. I don't have the answers, which is why I need other people kind of thinking through it. But I think it's again an opportunity that this is obviously relevant to our ISHLT community, but I think is an area where we could potentially interact with, you know, some of our ECMO colleagues. It links to biobanking, it links to pre-existing organ injuries. Like there's a lot of biomechanical engineering type colleagues that we have that could be brought in to help with kind of real-time diagnostics and things like that. If we had a framework of of kind of what are the biggest needs in this space, and then who are the partners that we need to actually kind of big picture. You think like, if these are the 5 needs, then what's the group of people we need? Where can we source the money to try to advance some of the tools and technologies? I could see that linking to grant proposals and grant competitions and things like that, but in a strategic way. Sort of less just see what people turn in, but try to guide people into certain areas of sort of concrete research ideas.
I mean, I think the last part of what you were saying is really important, in that some of these documents that don't necessarily meet consensus or guideline, that their benefit and utility is in shaping where the field goes from both a clinical and a research perspective. So defining new syndromes, or at least the opportunity for new syndromic definitions. So that's a little bit of what ALAD is, for those of you on the lung side. And then I saw Kadir had your hand raised. Sorry to call you out when your camera's off. We'll follow up on that later. These are great suggestions. Any other thoughts? Forum, you start off with biobanking efforts, which has been brought up several times by many different people. And so it maybe illustrates some of the challenges with the SNG process, is that it really requires a champion to push these things forward. But I do think understanding, or at least having some guidance on how to process the various samples that we collect is important, and it helps normalize science across centers and countries. So I do think that's a really important effort, though it's lacked a champion. Really is why it's kind of floundered to this point. So if there's someone's interested in pushing it forward, I think that it's my opinion, but it would be of great utility. And Darshan, you have your hand raised again.
Yeah, just on that point, I think Phyllis Billier, who's not here today, would be an ideal candidate for that. She's the director of the Peter Monk Cardiovascular Biobank here in Toronto. And it's, I think, one of the world's largest biobanking sampling organizations, with something like, I think, 1/3 biobank samples for something like 40,000 patients. It's a genuine interest of hers, and I think she might be the ideal champion if we're going to move that forward. Please don't tell her that I nominated her in her absence.
Mom's the word, as they say. Well, let me summarize what I have here so far. So there are several really great ideas that I think definitely should be originated from RIPSI and could move forward through the SNG process. And so I'm going to kind of summarize what we talked about. But as far as steps moving forward, if these ideas kind of germinate further, if you want to send them to me when there's this call for SNG documents, I'm happy to, on your behalf, move it into the IDN stages, shunt it to whichever IDN might represent it most, or give it to the RIPSI personnel that are on those IDNs as well. But for biobanking efforts, Forum brought this up, and so the to-do would be to reach out to Phyllis Billia to kind of tease apart the components of this. There's already an explanted lung and probably pulmonary vascular tissue document that's being put together by Teresa Martineau. So if anyone's interested in participating in that, I would reach out to her. Rich brought up complement biology and standardizing assays. I think I would recommend reaching out to Francesca Lunardi in lung, and then I didn't have time yet to look up who the cardiology or the advanced heart failure pathology representative is, but both of those people would be very helpful to start that conversation. And then we talked about cross-donor antibodies, and Darsha's going to chat with Megan Aversa, though that might be helpful to start out as a workshop, or to collaborate with some external immunogeneticists through ASHI. And then there's another one, animal models, that it sounds like we have some support in the chat from Stephen as well. And Mark Snyder was working on that, but if you're interested, reach out to me or Mark and we can loop you in. Did I miss anything? I'm happy to send this out to everyone as well, just to make sure we coalesce our efforts.
Is there also on the web, I think Greg put in the chat about the various document types based on the level of evidence and consensus. Is there somewhere on the website where there are more details about each of them, or if there isn't, then can something be sent out regarding as to which would fit, like, how to think about these?
Yeah, that's a great question. There's just a little bit of information on the website, but it's not going to be as helpful as we'd like it to be. But there is some on the standards and guidelines page. We are working on adding the level of detail that I think is what you're looking for and what we really need to provide.
Thank you.
Greg, do you mind sending that standards guidelines things out? Because it does help frame the types of questions, just knowing the scope of the of each document.
Yeah.
Yeah, thank you.
I'll put the link in.
And there will be a broader call when the S&G, the standards and guidelines process starts. Again, I heard that was going to be next month or maybe the month after.
Yeah, the identification of needs process will begin in just about a month's time.
It sounds like we're well on our way here at RIPSI. So thank you for your great conversation here and topics we've thought about. So I will follow up with everyone individually and just kind of outline next steps. And then other things to talk about are potential webinar and symposium ideas. Maybe a little early for symposium, but it's never too early to just kind of see what everyone's thinking about.
It's never too early for symposium.
I think it will be nice to do about vasoplegia post LVAD or transplantation. I think this is probably one of the biggest problem early perioperative. Yeah, some sort of severe SARS, and probably in 1 in 5 patients. I don't know how is your experience, but it looks like that is after LVAD or transplant. The both are a big problem, vasoplegia. But the question is, what is the definition? What are the immunological mechanisms? How to treat, or is how to prevent? But it has usually a big consequence for these patients with acute kidney failure or injury, and also I think yes, there's also probably some overlap with primary graft disease, graft failure after transplant. But I think there, sorry, I missed some part because of power interruption here, which never happens in Netherlands. But so I missed a couple of minutes of your discussion. I think.
Okay. That's interesting. So vasoplegia after LVAD and heart transplant, obviously not my background, but I know there's a heart failure or a shock workshop that's happening pre-conference. I don't know I haven't personally looked at the talks lined up, but I wonder if this is incorporated there. It might be a good starting point.
Yeah.
And we host on January 10th, the MCS webinar, and that was titled "No One Talks About Vasoplegia." And Phyllis hosted that. So I think that's, from my limited understanding, is kind of along the same lines. But I posted that link in the chat and it has the recording if you're interested.
Okay, thank you.
I was just going to add exactly that.
Yes, I see it.
They just did that in the MCS field, where they looked at post-transplant and post-LVAD implant, and they looked at the basic science behind it too.
Yeah, great. I think the immunological mechanisms of this is very interesting. It is something intraoperative probably. Why these patients have extreme CRS reaction, but it is nice that there's now more emphasis on this. The other part is a little bit of left ventricle assist device implantations, especially in destination patients, is the chance of myocardial recovery. This could be also interesting to have a topic. What are the factors influencing myocardial recovery in some patients? And also probably partial recovery is also better than local recovery. And this is especially important in patients with alpha-DAS destination therapy, not for patients on Brits. And yeah, I think this is also other talk that needs a little bit could be interesting to have with a webinar or symposium. How do you promote this? I know there is a VAT working group in ITA. It's also is part of this. But it is an interesting topic to come back probably next year, a little bit more as a symposium or between that webinars. And I must also look at especially if there is any any statement or guidelines in these, but these two points are there.
Stephen.
Yeah, thanks. In terms of symposia, last year, actually, I think it was your original idea, Danny, but I proposed a TCMR symposium, and I think TCMR continues to be a major issue in like acute rejection in lung and heart transplant. And I think revisiting that as a potential symposium was a good idea. It was, I guess, it wasn't looked on very favorably in the last round, but we could always try again. The other thing I was thinking about was some kind of on the kind of biomarker theme, like what are the a symposium on the ways of assessing the lung allograft, for example. What are the kind of new developments in that field? And you could sort of bring in sort of recent research on bronchoscopic findings, peripheral blood, so on and so forth.
I like that. So you're bringing up an interesting point. I also submit symposia. They also get triaged or not programmed as well. That's part of it. But I'm wondering.
I don't take it personally.
Well, no, I don't take it personally, but in the interest of improving or deciding if it would be viewed favorably next year, I'm wondering, there was talk about getting some feedback from some of the reviews. Is it possible to understand what the reviewer said about it after the fact? Like, should Stephen reach out to the programming committee? Is that appropriate?
So we don't necessarily share the feedback from the committee. And also, we go through so many different symposia and it goes through so much of a kind of, compilation and adding and changing things and making adjustments. So the original proposal that was submitted, that transformation that goes through to the end, it really may not even be recognizable. So having a feedback on specific proposals is really difficult. We're looking into it, but from the changes that go through, it really is difficult to provide that specific feedback to submitters.
I mean, I think it, just broadly speaking, it might be helpful just to have some sort of, it doesn't have to be the minutia, but just for people that submit these, some feedback if it wasn't programmed, just to know, oh, it was a good topic, maybe it was just not timely this year, something along those lines. That's helpful, whether to move on or shelve it, so to speak, future years.
Absolutely.
But Stephen, also TCMR could be a webinar if it's not programmed. So, maybe I'm partial to that type of science, but I think it would be a really interesting RIPSI webinar to put on.
Yeah, I thought I might be preaching to the choir with you, Danny, but I think either format would be actually really good.
And then the assessing lung allograft function, are there other thoughts on that? Kira's shaking her head.
No, I think it's a good idea. I think one thought to consider for a lot of these ideas is I would say webinars are not interactive. Symposium kind of are interactive depending who's there and how much time questions are. But I think a lot of the sort of topics and struggles that we all want to hear more about, how different centers handle different things or how you assess different things, really require sort of highlighting of differences and opportunities and discussion about why different people may approach a patient or a situation or a diagnostic entity or whatever. So like, I mean, this could be, you know, incorporating diagnostic tools. It could be, what do you send on your bronchoscopies? It could be, you know, sort of kind of couched in the delivery of care sort of elements. And so I'm wondering if there's a way to make some of these a little bit more forced interaction. So like if we wanted to talk about you know, how to assess a lung allograft, can we do this with, you know, a panel of people where they talk about how different centers do it, or sort of push the community to discuss, to try to kind of build the thought process. I'll happily talk about assessing lung allografts and donors and anytime you want. I mean, I'll go to the seminars, I'll go to the, you know, but I think that it's more fun to teach and learn in an interactive way that helps build community at the same time.
You know, I think it's ATC that has these, I think they're during the industry time, so they're not CME sessions, but they're called Meet the Experts. And so it's a few people that have subspecialty expertise in a topic. And I went to one on AMR, and it was small room. There were about 30 of us. Everyone sat to the front, and they had some cases they presented, and then just kind of pulled the audience. And it was a conversation across everyone that was there about how different centers kind of encounter and manage these big problems where we don't have guidance. And so something like that almost is what you're describing here, and it would be, I think, really cool for this this kind of a topic.
I think those can sometimes, I mean, I remember the one we had on ALAD, where it was organized as a symposium, but generated a ton of discussion that sort of directly led to a consensus group. And it was really fun to see that enthusiasm come through. And I think a lot of the ideas that we talked about for where we need standards or where we need guidelines or where we need consensus reports, and then some of these seminar ideas, I think we could try to capture that a little bit and help. Because I think sometimes when you put a research and immunology framework on it, people say, well, I'm not an immunologist or I'm not a basic science, but like clearly this is important to our colleagues with more clinical positions. But I think the more we can do to try to integrate the sort of sooner we get our ideas and curiosities back to patients.
Darshan, I see your hands raised. Thank you for your patience while the pulmonologist talk. Yeah.
No, that's no problem. It's my first town hall, and I don't know if I'm speaking too much. If I am, I apologize. One of the things that's brewing in transplant in general, and it's an argument that I'm fortunate enough to be sitting at the in the front seat of, is the role of clonal hematopoiesis in thoracic transplantation and where that's going to lead us. And there's two different groups of thought who say that it may be important, it may not be important, and it's quite a hot topic. And I wonder whether that might be a appropriate symposium, just because it's quite what's the word? Quite well supported and well-renowned opinions against it, and some very strong voices for it. And I think that would be particularly one of those grand debate type symposium, which ends with a debate between two charismatic individuals. I think would be a very compelling symposium idea.
I think that's a great idea. You know, in the lung, there's some evidence to support that in both IPF as well as after lung transplant. I know the Duke group, so Scott Palmer and Jamie Todd have published on that in a couple of different manuscripts. So that I'm sure half the people here don't, well, maybe I'm not. I think it's a topic that's kind of new and novel, and would you know, certainly as a symposium would be a good format to review what it might be, and then the specific applications and the risk factors that might be posed by clonal hematopoiesis. So I think that'd be great. I would encourage you to reach out to either Scott Palmer or Jamie Todd if you're putting together a proposal. Someone else might also be working on that too. Is it Phyllis that had some? Yeah, Phyllis. Yeah.
It's Phyllis is very pro, and people like Mandeep Mehra and Peter Libby are very against in the heart field. So it's, you know, it's a area of like I said, great debate. So
You could do a pro and a con in the heart field, and then also the pulmonologist would be like the third. Don't forget about us. That would be very interesting.
they could settle the debate.
Or just muddy the field. Yeah. Other thoughts? I guess something I've been thinking of, we only have a few minutes left, and this is more for Greg. The ISHLT Research Foundation, and this is not to be too North American or US centric, but kind of in the face of all the uncertainty around funding, I'm wondering, are there events that the Research Foundation is putting on at upcoming in Boston that we should be aware of? How do we kind of popularize that?
Yeah, the foundation is not, well, there's a KOL symposium, but that's invitation only, supported by a grant from one of the foundation donors. We are once again putting on the DEI symposium on the pre-conference day, and that is supported by the ISHLT Foundation and ISHLT. But there are not any other directly funded programs from the foundation this year.
Is there going to be a gala in future years? I know like ATS does a gala and it's a big money raiser for the foundation, I think.
You bet.
Okay.
This year there will be a reception in Boston, and then we're planning the first gala for 2026 in Toronto.
Tuxedo, black tie event.
Polish your
Well, I don't have anything else. Are there any thoughts or questions, concerns that anyone here has for the RIPSI leadership or RIPSI in general?
Thank you for leading this. Like,
yes, thanks for
done it with gusto. We very much appreciate it.
I was just gonna say, Danny, you're not allowed to move on. You've done a great job.
Well, I thank you all for being here and taking time out of your really busy schedules. I know you're all passionate about thoracic transplant. Looking forward to seeing you all in Boston. And I will follow up as soon as I can with all of these great ideas, just to make sure we catalyze all of what we've begun. Have a great day.